Hi, in this video we'll be talking about loop diuretics. But before that, what are diuretics? Diuretics are a class of drugs that increase urine production. But when do we need to increase urine production? We need to increase urine production in cases of congestive heart failure, which cause edema, or in cases of chronic kidney disease that decrease production of urine. Also, we can use it to treat hypertension because increased urine production would lead to decrease in blood volume, which would consequently lead to decrease in blood pressure. Now, let's talk about loop diuretics. We will talk about the site of its action and also the mechanism of its action. As its name suggests, loop diuretics, it acts in the loop of Henle of the nephron, specifically the ascending limb of the loop of Henle. Now, let's take a closer look at the loop of Henle. We have the lumen, epithelial cells that act to reabsorb and transport. Also, we have the interstitial space. There is a cotransporter located on the epithelial cells throughout the lumen of the ascending limb of the loop of Henle, which is called the NAK 2Cl Cotransporter. It acts to reabsorb sodium, potassium, and chloride from the lumen into the epithelial cells, which would later be released into the interstitial space. This would in turn increase the osmolarity of the interstitial space, and water moves from the lumen into the interstitial space. This way, water and electrolytes are reabsorbed and they are not converted into urine. This happens normally, but when we use furosemide, the most commonly used loop diuretic, it can block the cotransporter, blocking the reabsorption of sodium, potassium, and chloride. This would in turn decrease the amount of sodium, potassium, and chloride released into the interstitial space, which would subsequently decrease the osmolarity. Therefore, water would no longer move from the lumen into the interstitial space. Also, the electrolytes are blocked from reabsorption and they stay in the lumen. This would lead to increase in urine production, and we can use the drug to treat the diseases that we talked about before and many more diseases.